And you are good to go, Lisa.
Great. Thank you so much, Amanda. Hi, everyone. Again, this is Lisa Yuchi. I am an epidemiologist with the Oregon Health Authority's Healthcare Associated Infections Program. And today I really want to focus our time to provide updates to tracking and reporting of COVID-19 vaccination in long-term care facilities. So thank you all for attending today and for taking time out of your schedule. Really, this is meant for facilities who report weekly COVID-19 vaccination information to us, either through the National Healthcare Safety Network or through our online reporting survey. This will focus on the updates that we have recently made. So if you are completely new to this reporting and want to provide an overview, we do have a prior recording that is available on our website that provides a broader overview of the tracking and reporting for COVID-19 vaccination. And I will show that in one of my slides. Get to the next one. Okay, so the main objectives that we have today are to discuss the current recommendations for COVID-19 additional dose and booster vaccines, as well as review the updated resources that we at OHA have developed, including really focusing on the OHA tracking tools. And then we want to highlight the new questions that have been added for COVID-19 vaccination reporting. So the current recommendations that I'm going to review are really ones that have just recently been released and recommended by the CDC as of last week, Thursday. And what I'll be reviewing is recommendations for both an additional dose as well as a booster COVID-19 vaccine. And I really want to be sure that you guys have an understanding of the distinction between an additional dose versus a booster recommendation. And I will say that, I think there has been a lot of terminology that has been kind of confusing for people to understand what is the difference between additional dose, a booster, or a third dose. The terminology that I'm sharing here is the terminology that CDC uses in their recommendations. So here is a slide that provides recommendations for an additional dose. And when we're referring to additional doses, we're referring to an additional dose of vaccine administered when the immune response following the primary vaccine series is likely to be insufficient. So in this instance, we're saying that an individual who had their initial vaccine series did not have a sufficient immune response to that initial series. And the additional dose recommendation is really specific to those individuals who received an mRNA COVID-19 vaccine dose who have moderate to severe immunocompromising conditions. And when we refer to mRNA COVID vaccines, we're referring to just the Pfizer or the Moderna COVID-19 vaccine. So if anyone who's received either the Pfizer or Moderna complete series and has moderate or severe immunocompromising conditions, it is recommended that they get an additional dose at least 28 days after they had their second dose of the primary series. And with these additional dose recommendations, it is recommended that they use the same vaccine manufacturer product for that additional dose. So if they got 2 doses of Pfizer, they should get an additional dose of Pfizer. I will say too that it can be challenging to determine if someone, especially a staff or resident in your facility, has any moderate to severe immunocompromising conditions. There is a list on the CDC website that details what types of conditions we're referring to here. But I think it's important to at least educate your staff and residents about what these additional dose recommendations are and that they're distinct from the booster dose recommendations. So as I mentioned, that was additional doses. These are the booster dose recommendations. And when we're referring to booster doses, we're talking about an additional dose of vaccine administered when the initial sufficient immune response to the primary series is likely to have waned over time. So for these individuals, we think that you did mount a sufficient immune response to your primary series, but just because there has been some time past, that immune response has waned. And so a booster dose is recommended. And as of last Thursday, booster dose recommendations are really for all of the three currently FDA recommended vaccine types in the United States. And they are distinct between Pfizer and Moderna versus the J&J vaccine. So for individuals who received a Pfizer, BioNTech, or Moderna COVID-19 vaccine, the following groups, as I've listed here, are eligible for a booster shot at least 6 months or more following their initial series. And really for long-term care facility settings, I think what's going to be most relevant is that there is the recommendation for any residents who are 18 years of age or older to get a booster dose. And then anyone who works in high-risk settings, such as long-term care settings, the recommendation is that they may get an additional a booster dose, or they're eligible for a booster dose. For anyone who received the J&J vaccine, if they are at least 18 years of age or older, and were vaccinated with that initial J&J shot 2 or more months ago, then it is recommended that they get a booster dose. And for booster doses, the recommendations are that mixing and matching can be done. So if someone got their primary series with Pfizer, they can choose to get a booster dose of Moderna instead. It doesn't have to be the same product. So generally, I would say that, in terms of determining eligibility for staff and residents in your facility, the first things you're going to want to look at is what type of, COVID vaccine product did they initially receive, and then also the timing of when they received that. So for Moderna or Pfizer, if they received their complete series 6 months or more previously, then they are not eligible for a booster shot. And then for the J&J, if they received it more than 2 months ago, then they're not eligible for the booster shot. This link I have at the bottom is the CDC website that includes interim clinical considerations for use of COVID-19 vaccines. We recommend just going there as it provides very comprehensive information about all of these recommendations, and it's going to be really where you're going to see the most up-to-date information about what the current recommendations are. Just to kind of, as I mentioned, there are different terminology that has been used. This infographic was just developed by the Oregon Health Authority, but it provides a quick summary of what I've just mentioned before. Oh, I think the power went out okay, it's back on. My apologies for that. So there is an infographic that says, am I eligible for a third dose or booster? And this is really the third dose is really what I mentioned, additional dose. So that terminology is interchangeable. But here it allows you to kind of quickly see whether or not you are eligible for a third dose or a booster. So I've included a link here of where this was posted. It may be helpful for you guys to share this with your staff or residents in your facility to kind of get them to review their own eligibility for boosters or additional doses. Now I want to focus on the updated OHA resources, and I really want to focus on the tracking tool updates. So I'm hoping that all of you on this call are familiar with our tracking tools and have been using them. We have developed standard Excel tracking tools that are really intended to assist both with your own internal facility tracking as well as with the reporting of summary counts to us. And here I've just included links to the most updated tracking tools for your reference. In the updates that we had sent out earlier this month, we have made some changes to track the additional dose and booster eligibility and receipt, as well as to make sure that for the staff tracking sheet, we align our staff categories with the federal classification. There are facilities who report directly to the National Healthcare Safety Network, and the National Healthcare Safety Network recently updated their staff categories to be different than what it was previously. And so we wanted to ensure that the tracking tool still allowed reporting of those counts to both NHSN, as well as ensuring that we are able to compare the NHSN data that we get to the data that is reported directly to our reporting survey. So I will review updates with some of the screenshots of what the tracking tools look like. So there are new fields that have been added, as you can see. The first one is the healthcare personnel category, which there was previously this column in the prior staff tool, but now there are new drop-down options, which I will show in the next slide. Then there are 3 additional columns that ask about additional dose and booster information. The first one is asking about whether or not an individual is eligible for an additional or booster dose. And here you will just enter in yes or no, as I mentioned, based on whether they received their primary vaccine series and the timing of when that was, or if they have moderate to severe immunocompromising conditions, as well as if they did receive an additional dose or booster, entering in when that was received and what type of vaccine manufacturer that was for. Note that here we're asking about additional dose or boosters kind of in one grouping. So we're not tracking additional doses separately from boosters. Just if someone is eligible for either an additional dose or a booster, then you want to say yes in the second column here. The other column that has been added is an optional column. This is a column to document when vaccine education was provided. And this is not information that we at OHA are going to collect or ask of you. Really what the reason why it was added to the tracking tools is because there is a CMS federal requirement for nursing facilities to provide vaccine education to their staff and residents. And so this being able to document it on the tracking tools is just one way to show proof that vaccine education has been provided. So if you want to use this column, you're welcome to do so, but it is an optional field. Here is a table that I pulled from our updated supplemental guidance document that categorizes the staff in these updated categories. So all healthcare personnel is basically the sum of 4 drop-down options that you have on the tracking tool. And that is if they are an employee, so any staff on the facility payroll, or if they're not an employee. And if they're not an employee, then we ask that you classify them as either a licensed independent practitioner, an adult student / trainee or volunteer, or other contract personnel. And so previously we asked you to classify staff kind of based on their role, such as aides or therapists or physicians. Now we're just asking you to tell us if they're an employee on your payroll or not. And what should be included on the staff tracking tools is any persons who typically work in your facility for at least 1 day per week. So that is just, the guidelines that we have in terms of thinking through, who should be included in the tracking tools as well as reported in the staff summary counts.
Hey, Lisa.
Yes.
There is a question in the chat, and I know that you'll address it again later, but I just wanted to throw it in now. If we're reporting to NHSN, do we still need to start reporting to OHA again?
Good question. I will mention that later, but no, if you are reporting to NHSN, then you do not have to report directly to us as well. We pull the NHSN information on a twice weekly basis, and so that fulfills any reporting requirements for those facilities that report into NHSN. Thanks for the question, Amanda, and thank you for bringing it up now. I will kind of get into the reporting in the next section of my presentation. Oops. Okay, so the other thing I wanted to just mention in terms of some tips on how to use the tracking tools is if you are using the prior versions of the tracking tools, rather than having to re-enter all of your data from prior tracking versions, you can easily copy and paste the data that you have, but I am outlining some steps to do this because there are some columns on the tracking tool that auto-populate, and we want to just be sure that when you copy and paste it over, those kind of auto-populate functions will still work. So we recommend that you first copy and paste all your data from columns A through J. So that is the start of employment, or if you're looking at the resident tracking tool, it would be the resident admit date up until this column about dose two vaccine manufacturer name. So you would copy, from this row down until the row where you've had your last data entry, copy that, and then paste it into the new tool. And then what will happen is column K, which asks, is vaccine series complete? It will auto-populate as yes for those situations where it can determine that based on what you've entered, vaccine series is complete. There will be some cells potentially in here that will just flash as red because the formula is unable to determine if vaccine series is complete or not. So for those, we do ask that you just manually enter in yes or no. After you've copied in data from columns A through J, then you would want to just copy and paste the data from columns L through P, which is adverse events, up until the history of lab positive COVID-19. And then column Q through kind of the rest of the columns are the ones that I just reviewed before, which are the new columns about staff categories as well as additional dose and booster information. So those then you would want to go through and fill out for the staff and residents in your facility. The other situation that we wanted to mention is that if there are staff who are on extended leave currently due to the vaccine mandate, you may have questions about whether or not to count these individuals in your summary counts. The general guidelines that we have is that if that staff is on temporary leave that is anticipated to be less than 2 weeks, we do advise that you still include them in your count. So you would not need to kind of take them off the list or put in an quote unquote end of employment date. But if their temporary leave exceeds 2 weeks, then we do ask that they be kind of taken off of your summary counts and not counted for that time frame when they are not physically in the facility. And so if temporary leave exceeds 2 weeks, what we recommend doing is adding in their last day of work before their extended leave as the end of employment date on the tracking worksheets. So in this example, I put in 10/18, 2021 as this person's end of employment date because they're going to be on a 4-week leave. When they return to work, I would put in their return date as their new start of employment date. So here you can see in this example, I put 11/20/2021 as their new start of employment date, and I remove their end of employment date. This will allow you to not have to delete this person from your tracking sheet and not have to add them as a new employee, but will allow you to just make sure that they're counted for the weeks that they are in your facility and not counted for the weeks that they are on a more than 2-week extended leave. Amanda, are there any questions? I'm seeing some notifications in chats. I just wanted to pause.
There was one that was about copying pasting, but I believe that you answered that with the previous slides. And then there is one asking about a printed version of the slides, and I've asked for clarification if that's a physical copy or if they just mean an email version that can be printed.
Okay, thanks. Okay, so this is your weekly summary sheet, which I'm hoping that you are familiar with seeing. What has been updated here is the staff categories have been updated to reflect the new staff categories. And then also we have the section on the bottom that is about additional dose or booster questions. And so here you can see that for the additional dose or booster questions, what is being summarized is the cumulative number of staff, or if you're on the resident tool, it will be the cumulative number of residents who are eligible to receive an additional dose or booster COVID-19 vaccine. And then of those, how many have received an additional dose or booster COVID-19 vaccine. And that is broken down by the vaccine manufacturer type. For the reporting to OHA, the red cells listed here are what is being asked as required summary counts for reporting. I will note that if you are a facility who reports to NHSN, I think the required fields are different, but the sheet here that summarizes the data for you will still provide you all of the summary counts you need to report that data into NHSN as well.
Lisa, one question is, should we only copy and paste current employees and leave off employees who have termed their employment?
Yeah, you can definitely do that. That way you don't have to go in and through and fill out like staff categories for all the people who are no longer in your facility. It's really up to you in terms of how you want to best manage that. If it's easiest for you to just copy everything over, or if it's preferred that you filter the data and only include those who are currently in your facility. Since we asked just for the weekly counts of people who are in your facility during the reporting week, then yeah, you do not necessarily need to include those individuals who are no longer in your facility.
Right, and then a second one is regarding employees that return after extended leave. Louisa is saying that she has been removing the end of employment date and keeping the original hire date. So do you want them just to correct the entry moving forward, or does that need to be changed fully?
I might follow up with you, Louisa, after, just because I want to make sure that I completely understand what you're asking. If you have someone who you put an end of employment date and that end of employment date is kept for the duration of that they're on leave, and only when they return then you take that off, I think that is fine. But I'm happy to just follow up with you after this just to make sure I completely understand how you're documenting it.
That's all for now.
Okay, thanks, Amanda. Okay, so currently we have the version 6 of the tracking tool. If you want to double check which version you're using, you can go to the instructions sheet, which is the first sheet on your Excel tracking tool, and it should say on the top the version number and the date. As I mentioned, with this tracking tool updates, please reclassify your staff using the new staff categories. If you copy over the old categories into this new spreadsheet, you won't get those summary counts that are summarized by the new categories on your weekly summary sheet. Also, as I mentioned, that vaccine series complete column is something that auto-populates. So again, if you copy that over, the auto-populate function may not work as intended. And then if for some reason that column is highlighted just as a blank red cell, that is a prompt for you to go in and fill in yes or no. We have updated this version to prevent deletion of rows because we have seen that it can cause calculation errors, but I am just reminding folks that if you do delete rows or insert rows, this can cause some of the calculation errors on the back end. And then also reminders just to be careful and double check what dates you have entered in your columns, because the formulas are really looking for certain dates. And I think, what I've seen in the past is that if counts look off, then oftentimes it's just a typo or entering in like a future date like December 2021 instead of 2020. So just double check that if you're seeing that your counts may look off. But again, you can always reach out to me as well, and I'm happy to troubleshoot any of those types of errors or things that may look off. Okay. And we have posted all of our updated resources on our OHA healthcare providers page. Here's a screenshot of where all those resources live. It's under the long-term care facilities section. And what I'm kind of highlighting here is that we have updated not just the tracking tools, but also the frequently asked questions document, as well as the supplemental guidance. Additionally, as I mentioned, we do have a webinar recording and our slides from our prior webinar, where we really provided a larger overview of the tracking and reporting process. And this is where we will post today's updated recording as well as the slides. So now I'm going to focus on reporting to OHA and the new questions that have been added. So we have come, a long way since we first asked for this data in March, and we definitely appreciate all of you for assisting us with reporting this information. It's extremely valuable, and we really appreciate your assistance to get this important data to us. I'm just highlighting here that in October, we did modify our rules to collect data on additional doses and boosters of COVID-19 vaccine, and being able to track not just, who's completed the primary vaccine series, but also who's getting additional doses or boosters is really important for us to understand progress with that, see where we need to maybe identify needs or provide additional resources or assistance. So this is going to be another component of really valuable information going forward. As I mentioned earlier, this is going to be the same rate for reporting. Nursing facilities who report to NHSN can continue to just report to NHSN for meeting the OHA reporting requirements. And if you have any questions or need assistance with NHSN, you can always reach out to me and I'm happy to assist. For those facilities, specifically assisted living and residential care facilities who do not report into NHSN, then we ask that reporting be done through the OHA online reporting survey. For those people who do report into NHSN, the following slides are going to be focused specifically on the OHA reporting survey. So I will just note that this is not relevant if you're reporting to NHSN. This is really focused on those people who report directly into our online reporting survey. So here is the first page of our reporting survey that you'll see. What I'll just note is that all of the text in blue notes some of the updates to the reporting survey that have been made. This provides you with the links that I mentioned to the tracking tools, the CDC website, as well as our providers page with all of the updated information. And then there's also a link to our quick start guide, which provides step-by-step instructions with screenshots. So I would recommend just taking a look at that if you have not, and just being kind of starting to use the tracking tools, updated tracking tools before you go in to enter in your data. So starting this week, once you log in and you click enter data, you'll receive this pop-up before you get to the main page of data entry. And this is just to alert you that the new questions have been added for additional doses or boosters. So as we mentioned, questions 4 and 5, which I'll show in the next slide, have been added to track the additional dose and booster, both eligibility and receipt. If you're on this page and you don't yet have summary data collected for those new questions, I would recommend either using our tracking tools or collecting that data in whatever method that you currently use before you go on to report this data to us, because these are required fields and you won't be able to proceed to submit your data until you fill those fields out. So here is the updated layout. As I mentioned before, we have added questions on the bottom, so 4 and 5, about additional dose or booster eligibility. And then this is the staff layout. So we have also updated it to classify the staff categories with the updated categories. And as I shown earlier, this layout here on the reporting survey exactly reflects the updated tracking tools weekly summary sheet. So if you are using the tracking tools, then you would simply have to select the week. So this week is 10/18 to 10/24, and then fill out these counts using the summary counts that you have from your weekly summary sheet. For residents, it's the same thing, just the additional questions have been added for additional dose or booster eligibility. And these are all, as you can see here in red, required fields. If there are any fields where it's 0, please enter in that 0. Don't leave it blank. If you leave it blank, it won't allow you to proceed on. So just as some reminders, for weekly reporting, we are asking again for cumulative counts. So this is how many individuals have so far received COVID-19 vaccines, not just the number of vaccines administered during the reporting week. As I mentioned, if any fields in red are not applicable, please enter in 0. Do not leave it blank. And then only put numbers in the fields. Do not put in any text. We're asking for summary counts. So we're looking at understanding numbers, and we use these numbers to calculate aggregate county or region level information. So please just put in numbers in the fields. There are formulas that are built in to our survey that are intended really to just make sure there are no data quality issues. Things like making sure that the number of people that you're reporting who got the vaccine does not exceed the total number of people in your facility. So, if you do get any of these pop-up messages, just double check your data to make sure that you didn't, accidentally type in a wrong number or something like that. If you are getting pop-up error messages and you're not exactly sure why that is occurring, please reach out to us and we are happy to troubleshoot that as well.
Hey, Lisa.
Yes.
For a couple troubleshooting things. One of them was Heather Lucas is asking if anyone else is getting multiple requests for the reporting surveys as if it didn't accept theirs. So she says every week she enters data on separate surveys for both facilities, yet she keeps getting surveys and once had a call that she hadn't completed it yet. Just checking if it's a bigger glitch or an isolated glitch in her case.
Okay, yeah, Heather, I'll follow up with you after this. Let me look at our survey system just to see exactly what you're referring to.
Okay, and I'll capture her stuff for that follow-up.
Thanks.
And then another one was for COVID vaccine reporting, no need to report to OHA if also or if already reporting to NHSN. Does this apply to POC reporting too?
No, point of care testing is a separate thing that I do not oversee. But if you do have questions about that, you can reach out to me. Maybe my email will be in the ends of the slide, and I can direct it to the appropriate folks, to my appropriate colleagues to kind of troubleshoot questions about point of care testing.
Well, I'll add that to her follow-up as well. So we are good.
Okay,
All right.
okay, thank you. Okay. And then just in terms of reporting, I do send out reminders at least twice weekly to long-term care facilities, and we send these out to the primary contacts that we have on file. If you are the primary contact and you do not get these emails, please let me know so that I can make sure that we have the appropriate primary contact on our list. If you know that the primary contact is going to change or you want it to be changed to someone else, please also let us know. We really appreciate that heads up so we can ensure that we're providing information to the appropriate individuals. And the last thing I just want to mention is that I'm hoping that all of you are familiar with the COVID-19 vaccination data dashboard. Here I've just provided a screenshot of kind of the top header of the dashboard that provides overall kind of snapshot of COVID-19 vaccination among long-term care facilities. We do update this dashboard on a weekly basis on Wednesday, so we'll update it tomorrow with the week of 10/4. If you haven't yet taken a look at this, I would encourage you to take a look. There is data that summarizes information kind of at the trends, provides a trend at the regional level, and then provides county and then facility level information as well. I will note that, as we're collecting this information on additional doses and boosters, we are planning to add an additional tab to the dashboard that would summarize some additional dose and booster information that is currently being kind of worked through as we start to collect data. If you guys have any thoughts or suggestions on what would be most useful for you to see in terms of summarizing some additional dose or booster information, please let us know. You can either put that in the chat or you can reach out to me after this call. And we can take that feedback back to our group who's working on developing this. And then here's just a summary of all of the resources that we have. This is mostly going to be the same information that is on our providers page, but I do want to note that there are some resources for nursing facilities with NHSN, and especially that there's a link here to the CMS nursing home data because we don't just publish it on our dashboard, but CMS is also publishing nursing home data as well as on their website. And with that, I will take any questions at this time, and thank you very much for your time today.
All right, so we've covered the questions that are currently in the chat, and then if anybody has any new ones, please either post them, or if you would like to unmute and ask now, that would be great. Is the new reporting due effective this week, or does it start last week?
So that's a good question. The layout right now is effective from the week of 10/18 to 10/24. That's when we're going to start collecting data for these additional booster and additional doses. And if you did not report last week, and there is an option right on the reporting survey for you to enter in your data from the previous week, you will see, I think, the additional questions about boosters and additional doses populate, but they're not going to be required for you to enter in your data in. So if you haven't yet reported for last week, which is 10/11 to 10/17, and you go in and click that orange button on our survey and enter in your data, you should still just be able to enter in data for questions 1 through 3 and proceed without having to enter in data for questions 4 and 5, which are the new questions. I hope that helps answer it.
Thank you. The next one is, are you going to make all of the spreadsheets available in a clean XLS file?
Well, right now the spreadsheets there are 2 separate spreadsheets. One is for staff and one is for residents. There are separate files and they are Excel documents. So I'm not sure if I completely understand the question, if what exactly is needed differently than what we have provided.
David, are you able to unmute and follow up on that? He's asking, where are those documents?
Yeah, just where are those files at, Lisa? The spreadsheets today are the first time I've seen a spreadsheet. We do our reporting straight on that OHA survey, so I hadn't seen the spreadsheets before.
Okay, yeah. The spreadsheets are on the provider's page that I've linked here, but they're also, David, when you click on the survey, that first, let me go back here.
And I just posted the link to that page that Lisa is referencing. And if you scroll down, it's under the long-term facilities.
Yeah,
piece.
and then David, when you click on, this is going to be your landing page when you get to our survey. You can click on this, the tracking tool, the staff tracking tool, and the resident tracking tool, and this will allow you to download those 2 Excel sheets directly as well from here.
Oh, okay, very good. Yeah, I just had not used those before, so okay. Thanks, Lisa. Always appreciate the help.
Yeah, of course. And David, if you have questions about it, this kind of today was just an update about what has been added to the tools, but if you have questions about just using the tools in general, you can always reach out to me. But as I mentioned, we have some prior webinars where we more thoroughly went over all the steps of using these tools.
Understood. Okay, thanks, Lisa.
Thank you.
All right, and I do not currently see any other questions, so we'll give it just a couple minutes here in case any come up. And then just as a follow-up while we're waiting, if there's any more questions, the recording and the slides will be posted to that same site that Lisa has been referencing. It'll just take a couple days to get there. And then if you do have any other questions in the meantime, you can email Lisa directly. And her email is on the screen. It's lisa.c.iguchi@state.or.us.
Yeah, my last slide also has it, but it is right here as well. So yeah, please just email me and I'm always happy to assist.
All right, and I think with that, if you're ready, Lisa, we can probably go ahead and wrap up.
Okay, great. Well, thank you everyone for your time today. I hope that this has been helpful. As I mentioned, Amanda and I will work to follow up on those questions that we mentioned today, and I will get back directly to those of you who I need to. As I mentioned, if you do have feedback on the additional dose and boosters and the Tableau dashboard, please let us know, as we're still developing that now and do appreciate and value feedback directly from facilities. And then if you have any questions as you're working through these new questions for reporting or for tracking, I'm always available to assist. So thank you very much, and I hope you have a great rest of your day.
All right, and I am ending the recording.